Emerging Phonology with Semantics, Developing a Lexicon by Savannah Hegwood and Alexis Marshall. Emerging phonology refers to a time period when sounds are beginning to be used to form conventional words, or also known as the emergence of expressive language. Normally developing toddlers start to combine single words into two-word utterances by the age of 2. Some 2-year-olds do not reach this communicative milestone and fall behind. These children are referred to as late talkers and fail to achieve a 50-word vocabulary or two-word combinations. When compared to their peers with normal developing expressive language, these children can be identified by having fewer vocalizations, a reduced repertoire of consonants and syllable shapes, and inventory constraints in the final position of words. An independent analysis is a great tool to use when evaluating the child's emerging phonology. It examines the child's productions, but does not compare them to an adult model. The analysis collects the child's inventory of speech sounds and syllable shapes used. When combining phonology with semantics, expanding the child's expressive lexicon or vocabulary is important. The child's consonant inventory should be considered first. Usually, if the child has the words or consonants in their vocabulary, it is easy for them to produce. Syllable shapes are also considered in treatment. V, VC, CVC, and CVCV are early emerging syllable shapes. Since the goal of this treatment is to expand lexicon, it is important to stimulate shapes not in the child's inventory during therapy. Lexi, a 4-year-old African-American female attending Little Rock Elementary, was brought in with concerns by her parents. After evaluation, her hearing screening and oral mech exam were found to be normal. After collecting and analyzing a spontaneous speech sample and examining the data from the independent analysis, she exhibited a limited vocabulary, V, CV, and CVC syllable shape structures, and the primary use of the consonants P, T, and D. In this video, the goal is for the client to imitatively produce the phoneme B in the initial position of words with 90% accuracy for 3 consecutive sessions. This goal was targeted due to the nature of consonants already in the client's inventory. Data collection in this therapy session was taken with a plus sign for correct responses and a minus sign for responses that were incorrect. The clinician gave tactile cues and provided model examples for incorrect responses and verbal praises for correct responses.
How was your day at school? Good. Good. I'm glad you had a good day. Well, today in therapy, we're going to work on our B sound. Can you try the B sound? That was almost very close. Good job. I'm going to pull out some different fun toys you can play with today out of my magic bag. Let's see if we can have some fun today. Ball. Can you say ball for me?
Ball.
Excellent. Let's try it again. Ball.
Ball.
Good B sound. Good job, Miss Lexi. Oh, you hit me. What is this? Can you say basketball?
Baseball.
Good B sound. I heard that B sound. Good job. You like playing with the basketball? Alrighty, let's see the next toy I have in my bag. Baby.
B.
Good job. Good B sound. Can you say baby again?
B.
Good job, Miss Lexi. You are working so hard today. Let's see our next fun object. Can you say ball?
Ball.
Good job.
Football.
Good job, football. Excellent. All right. I bet you're going to like this next object I have. Oh, let's see.
Ball.
You like to blow bubbles? You say blow bubbles?
Blow bubble.
Good job. Good B sound. All right. Let's see if Miss Savannah can blow some bubbles and see if you can pop them.
Some advantages for developing lexicons are that therapy focuses on expanding inventory by targeting one phoneme at a time. A disadvantage is that therapy is not centered on reducing intelligibility. If the client's utterance is an approximation, that utterance is considered to be correct.